What's up, my financially intentional people? So today I wanted to mix things up a little bit and just share with you a story that's based off of inspiration. So if you guys have an idea or a concept that you want to put out there and a solution that you know will help people, this is a story of a person who took that nagging feeling that they know that they can change something and put it into action. So even though this does have a medical spin to it, I think all of you guys will get lessons from just doing the things and knowing what's possible. So Jessica and Andrew Roden are co-founders of Blox, a mobile app designed to help students and new graduate NPs and PAs feel less overwhelmed and more confident in fast-paced clinical settings. So Jessica's experience in urgent care and emergency medicine revealed how isolating those first shifts can feel without the right tools or mentorship. Andrew's experience as a clinical preceptor reveals firsthand how often students struggle to bridge the gap between classroom learning and real-world medicine. Frustrated by the lack of streamlined, reliable resources, they launched Blox in early 2025 to build a tool they always needed, something fast, practical, and made for early career providers. Their mission is simple: support the next generation of clinicians with high-yield clinical guidance that reduces stress, improves decision-making, and builds confidence. What's up, my financially intentional people? It's been a while since I've been joined by my medical professionals, and we are going to talk about innovation, inspiration, and what these two wonderful people are doing to change the game for our healthcare system, because we know it needs a reboot. Hey, Jessica. Hey, Andrew.
Oh. Hey, thank you so much for having us.
Of course, of course. And let's just start by giving the people a little bit of background. Like, how did you guys get into the healthcare space? You guys are in the ED, correct?
She started out in the ED and then urgent care world, and I'm in orthopedics and sports medicine. Yes.
Yeah, so we met each other in grad school and PA school and did our rotation year together and ended up liking each other a lot. Got married, and Andrew's from Chattanooga, Tennessee, so that's where we landed after school. And my first job out of school was in an ER, and Andrew just had an amazing job opportunity with the orthopedic group here in town. So that's how we got started.
Yeah.
No one in our family is in the medical field, which is strange, but yeah, first generation medical professionals.
I love that. And can you provide a little bit of clarity between what is the difference in what PAs do, what advanced practice nurses do, and what doctors do?
PAs and advanced practice nurses, in my experience, do the same thing.
Yep.
You realistically work pretty autonomously, and there are some fabulous nurse practitioners and there are some fabulous PAs out there. Physicians, I think, it is a little bit different because they have the ability to really specialize and do things like surgery, whereas like a PA or some nurse practitioners could not do that. But for all intents and purposes, every NP and PA I've ever worked with has functioned in the same capacity.
Yeah.
And the education is similar, correct?
It's similar but different. It's just a different type of learning model. Nurses are extending that kind of nursing approach, and PAs are more of the medical approach. And I think that they both have benefits.
Yeah.
But when it comes down to it, you do the same thing.
Yeah.
So ortho PAs don't like even assist in surgeries? I thought our PAs do.
Yeah, you can. I don't. I'm in 5 days a week. But yeah, no, we've got PAs who are doing in surgery 2-3 days a week and rounding in the hospital.
Just not autonomously.
Not autonomously, right? Like you're working under a doctor and
right.
Yeah, or not even under the doctor. You're just working under the healthcare system and licensed under them.
Yeah, with surgery, you can assist.
Cool. So what inspired you to try to create an innovative approach to changing the way healthcare is like accessed by creating your app?
To making an app when we have no business.
Nothing about
mean?
that. Yeah.
Yeah, like how do two PAs get into this app building space?
That first job that I had in the ER, I did not work at like a teaching facility or anything like that. So I didn't really have a mentorship or mini residency or anything like that. So it was very much trial by fire. I just figured it out on the fly, and I learned very, very quickly that there's a lot of resources out there, but there's not a lot of resources that new grads specifically need when you're just trying to get your feet under you. I don't need to read through paragraphs and paragraphs of data and research and text. Like, I have 5 patients in rooms. I need to know like how I can get them treated and out the door. So that was like 2.5 to 3 years. And then I transitioned to an urgent care, which was a new urgent care system. And they employed almost exclusively new grad or like in the first couple of years of their practice nurse practitioners. And they had the exact same experience that I had. And so fortunately at that point I had a little bit more experience and was able to share with them, this is how you do a digital block, or we could like bounce patients off of each other, but they're into the same problem. And I just kept having this thought that this is a problem that could be solved. And so I initially developed it with Andrew's help as a web app back in 2019. And then COVID happened. And everything fell apart. And then we had our first daughter, our first child. And then just a couple of years ago, we decided that thought never really left the back of our mind that we've got to try it. And so we started that process about 2 years ago.
Wow. And I know like it is a big undertaking trying to create a product like that, especially something that has to encompass a whole bunch of information and a whole bunch of moving parts, and in a space where everything is rapidly being updated. How do you guys keep up with all of that?
It's hard. It's really hard.
It's been a lot of time, a lot of hours.
Yeah, not much downtime for sure. But as far as updating the content and stuff, we're going through UpToDate and all of the other great resources out there. But with Blox, our app, we're going through that, but we're also using our clinical pearls that we've learned throughout the years of practicing.
Because there's the information that you need to know for a test, and then there's the information that you need to know when you're actually treating patients. And so
like real practice.
Yeah, it's kind of a blend of those two things.
Yeah.
It's difficult, but once we've got our format in place, we just sit down and crank it out.
Yeah.
And I know, so I'm a nurse practitioner, but I never practiced as a nurse practitioner. And like, I know trying to get to that comfort level of understanding like how to use this information to actually treat people is like a big barrier. And it was one of the things that I faced a lot, how to gather the proper information to do the right thing. And I can only imagine like how much more difficult it's gotten now because there's so much information out there, like how to filter through that information. But now, just like in the last couple of years, we've seen how the emergence of AI has really changed the game in our space. How do you feel like that matches up to what Blox does?
Yeah. So as of right now, we don't have AI integrated into our app. We are working through that process and seeing how that works with Blox. Yeah, AI is great for certain things, but you may not get the right information. It may not be tailored to that one patient. With Blox, we've kind of, like if, for example, someone comes in with a cough, fever, shortness of breath, whatever, you can type in those keywords and we tag those certain keywords to pull out the proper diagnosis. So it's, again, kind of our knowledge with what we've put together with UpToDate and all the other resources. But yeah, AI, it's coming. It's definitely not going anywhere. And so that's what we're trying to figure out how to make that mesh with Blox.
Safely integrated with all of the regulations that are in place, with all of the rules that are in place. So that's something that will be a part of Blox, but it will be pulling from Blox's repository of information rather than just Google.
Speaking of the regulations and practice acts and all of those kind of things, how is that implemented or incorporated into Blox?
So for Blox is not to be used as a medico-legal resource. It is a purely educational resource. It is not a substitute for clinical judgment or anything like that. So that's its own thing. There's just some things going on in the AI space that you have to be mindful of when you are in the medical world.
Yep. Yeah, 100% true. And the reason why I brought that up is because I think that people think that they can substitute that data for something that they find on AI, or that they can get around learning this information in a way that is supposed to be learned, so that you have good situational awareness, good clinical judgment skills. Like, those things cannot be taught by putting something and plugging something into an app.
Right.
And regardless of how good that app is, I think like apps and things like this should be used like as on a foundational level to help, but cannot substitute. But at the same time, like, the AI world is ever evolving and evolving so fast. And a lot of people are worried that it's going to replace their jobs or even take the place of thought out apps like this. And I was having in a staff meeting I was having with my coworkers this morning, I was just like, it's not. But what is going to happen is those people that are familiar with using those apps and that AI is going to replace you. And so I don't think that it's something that we should shy away from, but it's something that, like you said, needs to be incorporated responsibly, because you let it do its own thinking, it's going to just create all kind of things. And so I like the way that you said it's a tool. It's not meant to replace all these things that you're supposed to be learning and knowing and implementing in practice.
It's just a tool. It's just something to block out the noise when you've got 1,000 things going in your head. You've got something that you can go to.
So just like on a day-to-day, like practice basis, like when somebody's working, like how can they best utilize Blox?
I think so. Blox is really tailored to PAs and nurse practitioners, either in their student year, so going through clinical rotations or doing their clinicals, or in their first like 1 to 2 years of practice, if they're seeing really any same day acute complaint. So walk-in family practice, urgent cares, low acuity ERs, peds, ortho. Those are the people who are really going to benefit most from it. And like Andrew had mentioned, if you need to know, he looked up the other day, he can't ever remember the dose for Valtrex for shingles. So he pulled up Blox and it's like right there, and he didn't have to read a bunch of information. It's just right at the top. So you can use it that way. We have laceration guides, procedure guides. You can type in ear infection and see what comes up. There's relevant images and videos, and it's all contained within the app. So you're not having to bounce between YouTube multiple resources.
Mm-hmm. Does it help you come up with a differential diagnosis or other ways that you can look at things?
Yes, but in a practical way. I don't read like a big block of why it's not idiopathic thrombocytopenia. No, it's like very simple.
What you're looking for, how to treat it, what to document in your chart.
Mm-hmm. And then your differentials are like 1 to 2 lines of, if they've got this, consider this.
Yes. I don't know. It's me having flashbacks of not being able to differentiate between viral and bacterial conjunctivitis.
100%.
Everyone knows how to do that, okay?
I'm like, is it one eye or both eyes? I don't know.
And it's not like the virus is, okay, I know I'm not going to go to that other side. No one knows. It's all a guess.
We're just doing the best we can.
I was just thinking about like how helpful it'll be me remembering like all of my clinicals in like the different areas. Like you have to learn so much in these programs in such a short amount of time, even if you have been practicing. Like I'd been practicing as a nurse concurrently. And it's just a lot of information. So to be able to have a tool to like filter through that noise increases the efficiency. And also I would use it as like a study tool. Okay, like these are the things that I've seen. Like how could I streamline this? How can I effectively use this like to really learn this information? Have you seen people use it like in that case?
I've got students, PA students who rotate with me every month in the ortho clinic, and there's a lot of ortho in the app. So they'll use it, for studying before they go into a patient room, to just brush up on it. You shouldn't use this tool just to study, but yes,
of course.
Yeah, for sure.
Yeah, and I think that's really where it could be so helpful for students is you're studying all this textbook stuff or like board prep stuff, which is really not the same as what you're seeing in clinic. And then so Blox has those really practical pieces. And so if you can combine those two concepts, the textbook information with the clinical application, then that makes the studying that much more effective.
Yes, exactly. That's why I was like, that clicks to me because it's hard for me to digest that textbook information versus the clinical stuff. It just jives better, but the test is usually off of the textbook and stuff like that. So that makes sense to me. Like a lot of people see issues in their work, even outside of the medical field. I know just as a nurse, like every day I see crazy stuff that I'm just like, why don't we have solutions for this yet? When you guys were able to take that problem and create a tool around it. But again, you guys are medical professionals. You guys aren't business people. You don't have MBAs. Talk about how you were able to transition into that space.
Yeah, I'll just start out by saying I'm still full-time. Jess is now part-time, but she has done, I give her all the credit. I've been along to support and help with content stuff, but she is the brains for sure behind it.
It really just got to the point where the thought just wouldn't go away. Like it just felt like an inevitability for the life that we want to have for us and for our kids and our family, that it gives me chills that we had to try. And so the fear of not doing it was greater than the fear of doing it.
Yes.
And I am type A. I care about what people think. I don't want people to think I'm like dumb or like, why is she doing that? So to say that the fear of not doing it was greater than that is
huge.
It was huge. Yeah.
Just trying to figure out every step along the way. It's just been day by day, just trying to learn and read and talk to people and talk to people and talk to people. And when you don't know something, you just got to figure it out. Because we're not tech, we're not business.
Yeah, that's kind of like been my experience. First of all, when I started this platform, I was just like, I didn't start it to be an influencer. I just started it to share some money lessons with my friends, but the lessons around business, around how to create content, like how to grow a platform, how to work with people, and just like all these kind of things that I was not taught in school. It can be like super overwhelming, but also like skills that are intangible. And I know you guys have learned a lot, and I'm sure that things keep on evolving along the way. But what are some of the tools that you guys really found like really useful, something that you keep on going back to help you?
I think it's just having the right people around you, really. I mean, that is like the tool. I mean, there's software and stuff that we use, but it's really like we have an amazing developer. We have an attorney who is like so well-versed in this field, and we have an incredible support system. And I think that is really the most useful thing that we have, is just surrounding ourselves with the people who know the stuff that we don't.
Yeah. There's a good book called, I don't even know what the real title is, but it's about finding the who, not how. And it sounds like you guys did a really good job of doing that. Did you know that that's what you needed in the beginning to put those people in place? Or were you like really just trying to figure it out on your own at first?
Yeah, I think from the get-go, just like for the software development part of it, it was just trying to find the right team. And we interviewed probably 5 or 6 different developers, and finally we met this one team and we were like, okay, this is it. And so we found that, and then along the way they'll give you resources and people that you meet, and then other folks you meet, they just keep like stacking on top of each other. But I don't think we really knew from the get-go that that's what we needed.
No, it was a lot of like gut. Like, does this feel, and that sounds so lame, but it's true. Does this conversation feel right? Does it feel authentic? And it, like with our app developer, it did. With the other people who are helping us, it did. So that's just been the guiding light, I guess.
So who all encompasses the team around Blox?
This. This. No, it's our software development team. There's like multiple people there. And then just the people that you have to have to run business, our attorney, our CPA. There's someone I think we both know mutually that's been instrumental in helping us just in a mentorship capacity.
Yes.
But yeah, it's a lot of...
Day to day is just, it's just us right now.
You guys are doing some amazing things. But so once you start getting into the space, there's the technical side of building out an app. Mm-hmm. But then there's like the health information side and gathering that information and knowing how to filter in that information. How did you go about knowing how to and what information to incorporate?
Yeah, I mean, I'm ortho, so I did all of the ortho, and I did pretty much, I don't know, I guess we have 100 or so ortho topics. So it's just the most common orthopedic topics that I've seen in the past 10 years. Yeah, from a walk-in perspective, urgent care perspective. And I also work with some nurse practitioners in the urgent care setting. And so I kind of work with them. And then she did ER and urgent care for 5 or 6 years. So
yeah, and I was compiling all this information as I was doing it. And then really decided to take the leap to make the app. That's when I started really getting into the nitty gritty. But I think I had mentioned it before. Once we had our templated form and I made this kind of concept off of what I needed, like what I needed. So that was easy. And then from there, I think that's helpful for other people. And so everything else is just built on top of that. But it was a lot of doing it in the moment and then a lot of refining afterwards. But like I said, we started this process 2 years ago. So it was probably, we launched in March. So it was probably 1.5 years of just data.
Yeah.
And now we're talking to nurse practitioners, PAs, and they're giving us feedback saying, hey, we'd like to add this. So we're just adding as we hear from folks too.
Is there a way like in app to kind of like suggest topics?
Yes. There's a submit feedback button.
Nice.
We wish everyone would use it all the time. We want it to be, we know that it's useful. We want it to be as useful as possible.
Do you guys have any OB components to it?
GYN. Someone the other day was like, you need a whole psych, like a whole psych.
Oh my God. Yes.
That's a huge, especially like virtual psych medicine is massive. So TBD, but
yeah.
It's all GYN stuff.
Yeah. So I'm assuming that Blox refers to the how you structured, like how the app is, or where did the name come from? Or I'm making a big assumption.
It was actually
so corny.
Oh no.
We wanted something that 3, 4, 5 letters and catchy and it's supposed to be like the building blocks for your foundation kind of thing.
The building blocks of your clinical practice. Okay, that's not our tagline because it's too corny. But if it was acceptable, it would be. I needed 4 letters, I needed an X, and I needed something that could be trademarked.
Yeah.
So that's what
why an X?
I don't know. I just really wanted an X.
That was like one of our main criteria. It has to have an X.
What the word is, it just has an X.
It has to have an X.
It needs to be 4 letters. And from a business perspective, like getting a trademark is so hard. And so like getting a word that we could trademark was important too. But it is the concept is the building blocks of your practice.
I love that.
Yeah, so similar to what you were thinking.
Yeah. I guess I kind of got mixed up because you were talking about like how it's structured. Like you have this specific form. And to me, I was like, oh, that's perfect. That must be where the name came from because these are the blocks that things fit under. And so, yeah.
We can go with that too.
We like that too. That sounds better.
Honestly, we should just go with that.
Can we steal that? Is that okay?
You have it.
I mean, that's actually how it's like organized in the app is drop down. So.
You said it.
That's hysterical.
Yeah.
No, I love it, but this is how things go. It's just sometimes things are just like happy accidents, and it's just.
You're absolutely right.
And from the beginning of starting this, how many iterations have you guys gone through?
Oh man.
I don't know.
Yeah.
I lost count.
A lot. I actually was looking yesterday at some like old screenshots, and the very first like kind of draft of Blox came up. I was like, thank God we just kept working on it, because it was not good. A lot of design stuff, a lot of function stuff. I don't know.
Yeah. Couldn't put a number on it.
I really couldn't. Yeah.
The reason why I just say that is because I think a lot of people think that they have to get it right up front, or they have to have all the answers up front. And I always tell people, you just got to put one foot in front of the other and just get started, and especially in something that's so outside your comfort zone, so outside what you do on a day-to-day basis. Like you have to just dive in and do it, because you're never going to know all the moving parts you need, everything that needs to happen. So what would be your advice for somebody, medical professional or not, that want to go into this space of solving a solution for people?
You have to do it. I get chills again, because I heard this so many times when we were figuring out if we were going to do this or not. And everyone's just like, you just got to do it. You just got to do it. You just got to do it. And again, like, Andrew is here. He is go with the flow. He's just the best partner. But I'm very type A. What are people going to think? I'm scared. Like, the font's not right. And you just have to go for it. You just have to do it. And if it's on your heart and it doesn't go away, you got to try. Yeah. You got to try.
And that's coming from a type A person that needs to know all the answers.
But yes. Yeah.
And definitely put the right team around you.
That part right there. Perfectionism is an excuse for procrastination.
Yeah.
That's right.
Ooh. Yeah. Feel that.
That was not a jab at you, but I'm just saying.
No, it's true. So, yeah.
So what's your vision for Blox? Like, where do you want it to be in the next 5 years?
So again, I'm practicing full time. She's part time. I think we would eventually like that be our sole job. We would love to, platform wise, we'd love, as we can discuss, adding psych and adding OB, and I guess you could take it a lot of different places. You can even add PT, OT, there's different things, but yeah, definitely our full-time job, adding more content, more and more, I don't know, maybe question banks, integrating the AI, but
really just growing it. And I think too, like getting it into schools and programs to help their students. I think it's kind of the next thing.
Institutional access. Yeah.
Have you gotten any pushback from institutions or any hospital organizations that, we can't endorse this or share this because it's not an approved app or anything?
Yeah, we've talked to where we went to school, Lincoln Memorial University. We went and we're talking to their students, and they do have to say that they can't endorse it. But we're also in talks with trying to get institutional access with them. But haven't had any pushback. It's just lack of response usually is what it is.
It's just about getting in front of those right people. But I love that. I think, and I see that for you. Like, I just had this really clear vision that you guys are going to be in schools nationwide, because we need tools like this. And I really feel like schools don't have the tools, nor are they built to be able to keep up with information or have resources available for students like this. And so even if they can't officially endorse you to be able to have this as a suggested resource or anything for students, I think would be amazing.
Yeah.
It's made for them when they go on rotation.
Yeah. And I don't know if you've seen this, but like I said, I haven't been a practicing nurse practitioner, but I've been a nurse practitioner for a long time. And it's this like real lack of an ability to find mentors in this space. And like people are like out there seeking help and guidance, and the mentorship is, what do you see happening on your side in regard to that?
Do you mean like for preceptors, or
like from a business perspective, or what do you?
No, not from a business perspective, but just for like new nurses like coming out. I know this app is supposed to solve a solution, but I think it's because it solves a problem. I feel like, or it's like it creates a bridge for those people who are having a little trouble finding mentorships, or the mentors that they have can't really answer their questions. What have you guys seen? Do PAs just go straight into mentorships? I don't know how you guys do your residencies or whatever after your
Yeah,
programs?
it's usually like 15 months in the classroom, give or take, and then another 15 or so out on rotations for a month at a time. And you go to different specialties each month. And then from there, you graduate and take the boards and you're into school. They do have little mini residencies, 6 months or a year residencies with certain practices, but
Like Andrew had that, but the majority of people don't.
yeah.
And for us, our school vetted and set up all of our rotations and our preceptorships. That is not the case for a lot of people.
Yeah.
And I think the downstream effect of that is that you maybe have people who aren't as confident in their practice because they didn't have that ideal clinical preceptorship experience. For us, Blox can help to fill that gap, but I think that's a bigger, broader issue than what we're doing just on our own.
But the thing is that I feel like in that Blox can serve as like a tool to build that confidence so they know that they're not just coming in blind into a mentorship. They have some tools where they can ask questions, or they're just like, okay, this says this. This is how I was thinking about it. Is this right? And I feel like that's going to be like a more beneficial mentorship or preceptorship than somebody that just comes in there and just, I'm just here to learn. So that's, that's the way I was looking at it. Yeah.
Absolutely.
Yeah. I just like, as far as like, and this is just my curiosity, but are PAs, are there a lot of opportunities for PAs in Tennessee?
Yeah, I feel like it's pretty oversaturated.
Really?
Yeah. I do, but
yeah, I would agree. I guess it's like with anything, it's like who
Yeah.
For me, like when we graduated, so Andrew's from here and I'm not, and we did our rotation, our whole rotation year was in Florida. So when we moved back, he knew a bunch of people who could get him a job. I was cold calling places.
Oh my God.
I help her.
He did. He did.
I didn't just leave her.
No.
Good luck.
Every man for themselves.
But I think that's not uncommon. I think it's a lot about who you know.
Yeah.
And I think one of our professors told us this in school, but it's like you can have three things: the pay you want, the specialty you want, or the location you want. And you can only pick two of those. Like you can't have all three. So I think that kind of goes into it too.
Yeah, that is a realistic expectation to set up because yes, that is, yes. That is understandable. So what's the plan for getting Blox into the palms of all the advanced practice nurse practitioners is out there?
It is a slow grind. We are I was looking at your Instagram feed earlier. You have just done such a great job with that. I spent like all day doing content today because I'm like, I got to get on Instagram. But your stuff is funny and it's real, and I love it. So that's one piece of it. We're going and talking to students at schools and administration. That's another piece. Trying to work some different hospital connections that we have. So it's just a slow grind.
Have you guys hit up like professional groups or union? Do you guys have unions? We have unions.
No. We've done groups on like Facebook, big nurse practitioner PA groups that way, which has been really beneficial, but no, not.
Well, and I just joined our professional organization for our state as one of like our regional directors. So that's another piece, but it's hard. It's just us, and I'm trying to do content and then put the stuff in the app, and it's just a balancing act.
And be a professional.
And a parent. Yeah.
Yes.
So we're very fortunate in that we have each other and we have an amazing support system. So I have nothing to complain about.
Yeah.
But like overall, like I think you guys are an example of what's possible if you have something that's nagging at you and you just have to get it out there. And I teach my kids, or I try to teach them that if you're able to solve a problem for someone, you'll never not have a job. And I just feel like you guys are problem solvers, but there's so many people out there that have this itching and this urge to create something, but they just don't know what's possible. And so that's why I wanted to have you guys on, because I really just wanted to show people what's possible on top of like just having this extraordinary resource that we can use as healthcare professionals. But I think just people need to know, if you have something that's a legit solution, there's a way to get that out there in front of people so they can use it.
Yeah, absolutely. Just have to take the first step.
Yes, exactly.
Down and go for it.
Yes. I appreciate you guys for being on. I'm definitely going to be sharing. I'm sure also LinkedIn is like a great resource because that's more professional. But yeah, I'll be sharing in my communities that is somehow full of a lot of nurses and PAs. And I have a cousin that's a really good PA as well. But I'll definitely be sharing this as a resource. As a matter of fact, I got to hit her up. I'm going to send her the app right now. But yeah, I appreciate you guys for coming on. I am so inspired by what you do, especially with all the things that you guys have going on. And in knowing that what it takes to build something like this, I just wanted to say how proud I am of you guys, and that I can say that I was like one of the people in the beginning that hyped you guys up. And
you are so kind. That means so much.
Yeah.
We really appreciate that.
Yeah.
Oh, thank you. Yeah. And I'll definitely be sharing. And I just see like where this can go. And I'm just really, really proud of you guys and really happy, and just like congratulations on all of the major accomplishments that you guys are going to have. Yeah.
Thank you so much.
Thank you for having us.
kind.
You're welcome.